Good morning.
Hi.
My name is Claire Carlander. I'm going to be the nurse practitioner doing your physical examination today. How are you feeling this morning?
Just fine.
Okay, great. Well, what brings you into the clinic?
It's my annual checkup.
Okay, sounds good. Are you comfortable here?
Yes.
It's warm enough in here for you and everything?
Yes.
Okay, great. Let's go ahead and get started then. First thing I'm going to do is test all of your cranial nerves. So I'm going to have you occlude one nostril with your finger, blow out. Same thing on the other side. Blow out, so cranial nerve 1's intact. And then we'll do cranial nerve 2, which is going to be your visual acuity, which I'll do with a Snellen chart that we don't have here. So we'll go ahead and say cranial nerve 2 is also intact. And then we'll go ahead and do some of your eye cranial nerves. So just follow my finger. Good. Okay, keep following my finger. Now, look at my nose. Look at that far wall. Back to my nose. Grab my light here. Okay, just look right at my nose. Okay, awesome. So your pupils are nice and equal round, reactive to light, and accommodation, convergence, and accommodation are present, and your pupillary response is direct and consensual. So that looks great. So cranial nerves 3, 4, and 6 are all intact. So we'll go ahead and move on to cranial nerve 5 now. Just tell me if you feel my finger touch your face.
I do.
Okay, and here, and here, 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 here.
Yes.
Is it the same on both sides?
Yes.
Okay, great. Let's do cranial nerve 7 now. If you'll raise up your eyebrows and then puff out your cheeks. And then smile at me real big. Show me all your teeth. Great. So cranial nerve 7 is also intact. And then I'm going to test your hearing, which is cranial nerve 8. If you'll just cover that ear for me. And then just repeat after me. Pillow.
Pillow.
City.
City.
Coffee.
Coffee.
Okay, and then we'll do the opposite ear there. You'll repeat after me. Soap.
Soap.
Fries.
Fries.
Chair.
Chair.
Okay, perfect. So cranial nerve 8 is intact. And then I'm going to grab my light again here. And just kind of look in your mouth. If you'll open up and say ah. Okay, perfect. Go ahead and relax. So I can see that your tongue isn't rested in midline of your mouth. It's at the base of your mouth. There's no deviation. Your uvula moves freely. Bless you.
Thank you.
And then if you'll push your tongue out to the side of this cheek and then this cheek. Okay, great. So cranial nerves 9, 10, and 12 are all intact. And then I'm going to just have you shrug up against my hands there. Perfect. So cranial nerve 11 is also intact. Okay, so then we'll go ahead and move on to the head portion. I'm just going to inspect first, and the head appears nice and rounded, symmetrical. There's no visible masses or irregularities there. The hair distribution is nice and thick and even, kind of a light brown color. Any pain there?
No.
Okay, so I don't feel any nodules or masses or anything. And then I'm just going to feel your sinuses. Any pain in there?
No.
Okay, and then I'm going to percuss. You pain with that?
No.
Okay, so no pain in the sinus cavities. Go ahead and move on to your ears now. Any pain there? Okay, I don't feel any type of masses or lesions there. Okay, go ahead and take a look. Okay. Looks good. If you're a pediatric patient, I'd have to pull kind of down and back. But we can just do up and back since you're an adult and both of your auditory canals are nice and clear, free of debris. Your tympanic membranes are nice and gray, kind of pearly colored. There's no distorted light reflex on either of them, and all of your small bony structures are all well visualized. So that all looks great. Next, I'm going to just look in your nose. If you'll kind of just pull your tongue, here, goes back like that a little bit for me. Okay, so nasal mucosa is pink and moist. Bilateral turbinates are present. Nares appear patent. So that's all great. Is there any pain in here?
No.
Okay, and then if you'll close your eyes again, I'm just going to palpate your eyes lightly. Any pain in there?
No.
Okay, so no nodules or masses or anything. And then you can just kind of look at the at the wall there, and I'm just kind of look at your eyes. Okay. Okay. So red reflex is present bilaterally. You've got nice sharp disc margins. There's no nicking, no hemorrhaging, no lesions that I can see on the retina, so that's great. I can see that your sclera are nice and white, your conjunctiva are pink, your irises are round, they're kind of blue in color, and then the pupils are also round and symmetrical. So that's great. There's no type of lens opacities or anything like that from what I can see. Let's go ahead and look in your mouth one more time. If you'll open up and say ah. You already looked at the uvula, but the hard and soft palates are also both visualized there. So looks good. Your tonsils are 2+ bilaterally. Teeth all appear to be present. They're all nice and white. I don't see any bleeding, cracking, no lesions or anything like that in the gums. Tongue appears kind of nice and smooth. Can you lift your tongue up for me so I can look underneath the facial and everything is midline. So that looks great. Put this down. And then I'm going to just palpate your TMJ. You'll open and close your mouth. Perfect. And then kind of go side to side with your jaw a little bit. Okay, so no crepitus felt in the TMJ there. And then we'll go ahead and do all of your lymph nodes. So just tell me if there's any pain. We'll do preauricular, postauricular, occipital, posterior cervical, tonsillar, parotid, submandibular, submental, superficial cervical, deep cervical, supraclavicular, axillary, and inguinal. Any pain with any of that?
No.
Okay, perfect. I don't feel any type of swelling or nodules, no lymphadenopathy noted there on an examination. I'll go ahead and look at your neck. If you'll kind of just tilt back for me. Okay, so trachea appears midline. There's no JVD distension, nice symmetrical looking neck, and then I'm just kind of see if I can. So thyroid's not really palpable, which is normal. Go ahead and swallow for me. Okay, great. All right, let's go ahead and move on to your the posterior portion of your back. If you'll kind of stand up and just face that wall for me. So, and I might kind of be moving your tank top here so I can visualize everything, okay?
That's fine.
So we'll just kind of look first. The skin is nice, pink, warm, and dry. Color is consistent with ethnicity. It's grossly intact. Just nice, even respirations. There's no dyspnea or no heaves, no type of little chest noted, anything like that. And then I'm just going to kind of place my hands here. Okay, so your AP diameter is half of the transverse. Go ahead and palpate for any tactile for. I'm going to say we're 99 for me.
99.
And again.
99.
And again.
99.
Okay, so tactile parameters is negative. I'm just going to percuss. Okay, so resonance is sort of over all lung fields there. Any pain here?
No.
How about here?
No.
Okay, so negative for CVA, tenderness too. And then I'm just going to listen. Just take a couple nice deep breaths for me. Okay, now let's to the side. Okay, perfect. So lung sounds are clear throughout. I don't hear any type of crackles, no wheezing, no rails. Okay, so you can go ahead and lay back down on the bed for me. So first I'm just going to kind of visualize your chest here. Skin charger appears good. Once again, skin is nice and color is consistent with ethnicity. Skin is grossly intact. I don't see any type of masses or anything. I'm just going to kind of palpate. palpate. Any masses? No, any tenderness there?
No.
Okay, so no nodules or tenderness there. I'm gonna percuss again. Okay, so resonance is heard overall. Lung sounds there. So we'll listen again. Okay, perfect. Lung sounds are clear through it again. I'm just going to listen to your neck and temples too. Okay, so no bruise right there. And then as far as the chest goes, I don't see any visible pulsations or anything like that. Perfect. I'm just going to feel your precordial with my palm. Feel your apical pulse nice and steady and regular. And all the carotid pulses. So those are both 2+ bilaterally. We'll go ahead and do all of your heart sounds now. Just going to start off at the right sternal border, second intercostal space, listen to the aortic area. And then left sternal border, second intercostal space for pulmonic. Third intercostal space for Erb's point here. And then tricuspid. It's going to be fourth intercostal space, still the left sternal border. And then mitral down here, fifth intercostal space. And then clavicular line. Okay. Just do the same thing with my bell. Okay. So heart sounds are all good. I don't hear any clicking, no murmurs, no gallops. I can hear S1 nice and loud at the in the mitral area. S2 is loud as deaf at the aortic and pulmonic. And then S1 and S2 are equal at Erb's point. So that's great. So that's just what we want to see. I'm just going to feel your radial or brachial pulses. And then your radial pulses too, which are both going to be 2+ bilaterally. Great, breathe nice and steady and even. Let's go ahead and move on to the abdominal portion of the exam. If you'll pull your tank top up kind of to your bra line and then slide your shorts down, perfect. So I'm just going to kind of look for it first. So abdomen is nice and flat, symmetrical on both sides. I don't see any masses or irregularities or anything. Go ahead and just put your head up for me and then relax it back down. Okay, perfect. Any pain with that?
No.
Okay, so I don't see any signs of bulging or herniation or anything like that. So I'll just go ahead and listen first. Okay, normal active vowel sounds in all 4 quadrants. And I'm just going to listen to your vasculature, listen to the aortic area here. And then we'll do renal. And iliac. Okay. So no bruise heard there either, so that's great. Umbilicus appears well circumscribed. And then I'm just going to proceed with light palpation. You just let me know if there's any pain with any of this. Any pain?
Nope.
Okay. Don't feel any masses or nodules there. We'll go ahead and go to deeper palpation. Pain with that?
Nope.
No pain. Okay. All right. And then I'm just going to feel for your spleen here. If you'll take a big deep breath for me, I'm just going to kind of push down. Okay. And then for your liver, same thing. Okay. Good. So no organomegaly felt there. Just gonna percuss. Okay, timpani's heard over all 4 quadrants there. Go ahead and get your femoral pulses while you're rolling down here. Those are going to be 2+ bilaterally. I'm just going to listen as well. You can go ahead and get your tank top kind of situated there.
Thank you.
I would be, you'd normally be in a gown and I would be listening directly on the skin for this, but for the purpose of today's examination, we'll just do over the shorts. Okay, and no bruise right there. Okay, let's go ahead and move on to your lower extremities there. First, I'm just going to look. They're both symmetric in length. You've got good muscle distribution, symmetrical bilaterally. I don't see any lesions or masses. Skin is pink, warm, and dry. Color is consistent with ethnicity. Skin is grossly intact. I'm just going to kind of palpate. Any pain there?
No.
Okay, I don't feel any masses or nodules or anything. There's no pretibial edema. If you'll just bring this right leg up and kind of press it against my hand. Okay, and then relax. Or sorry, actually go back up and we're going to go down the other way. There, perfect. And then if you'll bring that leg out for me and then back in. Perfect. Okay, same thing with this leg. Push up against my hand. And then back down the other way. Bring it out to the side and back in. Okay, and we'll just do kind of passive range of motion. So let me move your leg here. Okay, and relax. So that's good. And then bend your knees for me. So you've got full range of motion. You've got good symmetrical leg strength there. No cruffiness noted in the knees. And then if you'll point your toes for me, flex them up towards the ceiling, in together, out apart, and kind of just roll them in a circle. Full range of motion of the feet and ankles there. And then I'm just going to feel for your posterior tibial pulses. And then dorsalis pedis, both 2+ bilaterally. And then I'm just going to look at your toenails here. You've got painted toenails, but they're nice and smooth. They're slightly convex. And you've got nice wrist cap refill there bilaterally. You'll go ahead and take your right kind of heel and move it up and down the opposite shin. Perfect. And we'll do the same thing with the other side. Okay, great. And then you can go ahead and sit up on the side of the bed again. Let's do all of your reflexes here. We'll do your patellar reflexes first. Okay. And then Achilles, back at the ankles here. And then test for Babinski, which is going to be on the inside of your feet here. Run up there. Okay, so Babinski is negative, but your patellar and Achilles are 2+ bilaterally, which is just what we want to see. So let's go ahead and just do the upper extremity reflexes as well. Just relax that arm in my hand here. So we'll do triceps first, and then you can kind of against me, brachial, and radial. Those are going to be all 2+ as well. Something on this side. And radial. Okay, 2+ on that side as well. Perfect. Let's go ahead and move on to your upper extremity strength. If you'll put your arms out in front of me, don't let me push, and then push down. Okay, and then bring your arms in like this, push against me, pull against me. Okay, perfect. And then out to the side, we'll do the same thing. Push up, push down. Okay, great muscle strength in the upper extremities there. If you'll squeeze my fingers real tight, good. Okay, go ahead and relax. And then if you'll take your fingers and kind of go rapidly back and forth like that, great. And then with your wrist, just kind of go up, down, in, out, around. Okay, and then take your fingers and then put them all out, bring them back together, and then kind of flex them in. Okay, so full range of motion of the wrists and hands too. So that looks awesome. I'm just going to look at your fingers too while we're here. Your fingernails are also painted, but nice and smooth, slightly convex. And let's look at the other side. You've got nice wrist cap refill on both sides. There's no signs of clubbing or cyanosis of the hands. Let's see. And then if you can also bring your arms all the way up for me, and then all the way back. Perfect. And then I'm just gonna move your arms as well. Feel for any crepitus, any pain with that?
No.
Okay, so no crepitus. Out as well. Okay, good. All right, so full range of motion of the upper extremities as well. And then if I'm just going to put my hand on the side of your face, if you'll kind of lean into it for me, and then the same thing on that other side. So good muscle strength of the neck muscles there. And then if you want to come up, down, and then side to side, then kind of turn side to side as well. Any pain with that?
Nope.
Okay, so good full range of motion of the neck too. If you want to go ahead and, well, let's do, take your pointer finger and then touch my pointer finger to your nose, back to my pointer finger, back to your nose. And then same thing with the other side. Finger, finger, finger to nose, finger, perfect. Okay. Let's have you stand up now, and I'm just going to test your balance here. If you'll put your arms right out in front of you, and then close your eyes just for a few seconds for me. Okay, so Romberg is negative, great. And then if you want to take a few just normal steps towards the wall for me. Okay, gait's nice and steady and even, symmetrical stride. And then if you'll come back on your tiptoes. Okay, perfect. And then you can go back the other way on your heels. And then heel to toe. Put your way back on this one. Okay, so gait's nice and steady and even. Perfect. Symmetrical stride. If you will turn back around for me, I'm just going to look at your back. Okay, so patient has good posture. The curvature of the spine appears appropriate. There's no signs of kyphosis, scoliosis, or lordosis. The scapula are symmetrical bilaterally, as well as the iliac crest, and then the gluteal folds as well. All symmetrical. Go ahead and bend forward for me. Okay. Any pain in here? No. Okay, vertebrae all midline. Go ahead and come back up. And then are you able to kind of lean backwards? Okay, and then go kind of side to side. And then kind of rotate from one direction to the other. Okay, good job. All right, well, I think that concludes everything today. Okay. Do you have any questions for me?
No, I don't.
Okay, well, it was very nice to meet you.
Thank you.
Enjoy
Nice
the rest of your day.
Thank you.